we all come from different backgrounds. We all have different histories. We all have different upbringings. My grandfather, who came directly from Cuba in the 1960s, when he was on his deathbed in the hospital, it was difficult for him to communicate to the nurses, to the physicians, which made it more difficult for the right diagnosis to be made. You know, there was mental health issues that was underlying his treatment, but for my mom and I being there, being in the health system, helping and translating, you know, he may have been misdiagnosed and may have missed out on opportunities. You know, I can tell you some barriers for Hispanic populations that are going to be more religious based, or it's going to be culturally based. So if, you know, you have bouts of depression or you start having anxious feelings, instead of going to a counselor, you're going to go to someone in the church. You're going to go to someone who's in your family. That's just the way that we were, I don't want to say built, but that's just how the culture is. And I think that is the really interesting thing about when you're receiving mental health treatment, or the barriers to mental health treatment, is you have to take into account the different upbringing, the backgrounds. That story is so personalized and individual that someone else is going to have a completely different view and different story. My roadblocks as a Hispanic or as a Cuban is going to be different than someone who came over from Venezuela when they were going through some turmoil. It's going to be different from people who came over from Spain. That background is really key. And I think because if you look at it through a minority lens, or if you look at it through a culture lens, you're going to get a description that's going to be more wholesome, because you can actually get to the why of some people's decisions on how or why they got there. And so, you know, we can sit here and go off on the barriers. We can do low income. We can talk about social determinants of health all day, and how minority populations typically have higher social determinants of health. The more barriers, the more language differences that there are, the more cultural differences there are, the less likely someone is to get care. It's a matter of how can you get people comfortable with receiving the mental health treatment? We have taken our DEI committee and we have kind of evolved it into an impact responsibility committee to focus on how Lucid can make an impact on our community of providers, on our members, and our employees. You know, you start off with your employee engagement to have your employees to understand why diversity is important.
I just said we all four wear glasses, and our glasses are for correcting the vision, so we see the world differently with our glasses off. And our lived experiences, that's what our glasses are for life. And the way that, you know, when we find out what other people's lived experiences are, then we can understand how they're perceiving the world. And that's the purpose of it.
It's very poetic, right?
Yeah.
Awesome.
And then you expand that to say, now that we understand everyone is different, everyone has their own different points of view, how can you reach into the community and help enable those community of providers? So how can we make partnerships with our community to say, hey, mental health is important. Let's get more members connected with providers who are based on their preference, which from a cultural standpoint, from a demographic standpoint, you know, as a Hispanic, going to be more comfortable with speaking with someone who's a Hispanic. And so it's about making sure that we have the right data sets for providers that we can appropriately match a member to that care. And then that's going to translate in a care setting to, if you understand the difference, then I think you can get a whole more wholesome picture of, you know, an individual to get treatment. You know, I think a lot of cultures treat getting help as a weakness or something that it should be frowned upon. And I think that's one of the barriers that can be broken is, you know, receiving treatment. It's no different than going through a diet or watching the food you eat. It is something that, you know, your body needs. Having tough conversations is something that we do in the work environment all the time. That shouldn't just be limited to work. If you can't have tough conversations with your family or with your friends, have those tough conversations or practice with a therapist, with someone who's clinically trained, because, you know, while clergy or someone of your family members or someone in the church will help and will listen, I think when you have a licensed mental health counselor who has training, the assessment that can be done, I think you're going to get much better treatment from someone who is clinically trained and who understands the background. It's not a weakness. Getting treatment is really a recognition that there's an issue and let's get it resolved.